All right.
Yeah,
Good morning. Good morning, Miss Nanette. All right. Okay. So everyone's coming in. I'm going to let them in exactly at 10. Is that okay?
Yeah, that's fine.
All right. Hey, Brandy.
Oops, I think I let somebody in.
No.
it's
Hi,
almost 10.
Brandy.
Half of them are note takers anyway, so I feel like uh, we should be good.
I am rejecting my note taker.
All right. And let's go ahead and start admitting. And then, Laura, if you don't mind.
She goes every Wednesday.
Hi, good morning.
Good
Good
morning.
morning. Good morning.
How is everyone this morning?
Good. Wishing I was outside on this gorgeous day.
Oh no, it's nice weather outside. Are you in Fresno, Brandy?
Yep.
Oh no, Fresno has nice weather right now.
It's pretty windy out here.
Yeah, no, truly, it is here too. Much more than I expected.
Good
Good luck
morning,
to anyone
everyone.
with allergies.
Oh no, yes, yeah.
Mm.
I know I've been having allergies this week. We've been having sneeze attacks all over the office here. Good morning, everyone. Good morning.
Good morning.
Good morning.
So we will get started in just a bit. We are waiting for additional individuals to join the meeting. Good morning. If you're just joining the meeting, good morning. All right. So Fedison, if we, oh, good morning. Edison, if we want to go ahead and get started, and then we can start letting individuals in, just so that we're staying on track with our agenda.
Sounds good. I think we might need to mute the group just to make sure everyone has their sound, so there's no sound.
All right. I think we muted. Can you guys all hear me? Yeah, all right. So good morning, everyone. My name is Maria Valdez. I am the Kings County Smart Referral Network for our Kings United Way office, and I'm going to pass it on to Fedison so he can go ahead and introduce himself as well.
Good morning, everyone. My name is Fedison Landicho. I am the Director of Data and Digital Strategy for the United Way of Tulare County, and I also oversee the SRN program for the United Way of Tulare County in Tulare County. So I just wanted to start with a SRN update for Tulare County. No new partners, but we are still looking for partners to onboard. So if there's anyone on the call that is from Tulare County or has a Tulare County counterpart, feel free to share. My contact information is in the agenda, and we can share it again in the chat. So I can outreach to those organizations, do demos, answer any questions about the SRN in Tulare County. So that is my update.
For our Kings County updates, We are happy to share with you all. We now have 16 agencies that are currently within our Kings County SRN platform. And with those 16 agencies, we do have a total of 59 users going into the SRN, actively logging in and responding to referrals on behalf of Kings County. So if you're interested on joining our Kings County SRN, my contact information is listed within the agenda as well. And you guys have my contact information there.
6 months. 7.
So that is our Kings County updates. And then let's go ahead and move on over to our agency spotlight. We do have Leslie on the call. Leslie, if you want to go ahead and share your screen, the floor is all yours.
Yes, good morning, everyone. Let me go ahead and share my screen here. Perfect. Can you guys go ahead and see that?
Yes, we can.
Okay, awesome. So my name is Leslie Corchado. I am a program specialist here with the Department of Public Health. We are currently rolling out a new initiative in the department, and so I'm happy to briefly give you guys an overview of our community wellness program, as well as letting you guys know how we can support residents in Avenal and Corcoran and how we can partner together. So about the Community Wellness Program, essentially it's a grant-funded initiative. It's supported through County Medical Services Program, mainly known as CMSP. It's a local indigent care needs grant. We were awarded this grant back in 2024. It's an implementation grant. This is a relatively new program within our department. We began implementing services and including outreach and care coordination about 6 months ago. October 1st of 2025 is when we piloted our program in Avenal. Essentially, the funding is specifically focused on improving access to care in underserved and rural communities across California. But for this specific grant in Kings County, we're focusing on Avenal and Corcoran, so two communities that essentially face barriers accessing care. We do primarily serve adults who may face challenges such as transportation limitations, any difficulty navigating the healthcare system, or managing ongoing health conditions, primarily diabetes and hypertension. We are not just providing referrals, we are actively supporting the residents to access care, so connecting them to services in the county. What we've learned is that majority of these individuals in Avenal and Corcoran normally have to travel outside, sometimes outside of the county, to receive services. And so we really want to merge that gap and assist them in accessing that type of care. Ultimately, the goal for us is to reduce barriers, improve the access, and then help residents get connected to the care and resources they need. So to understand why this program is needed, it's pretty important to take a look at what are the barriers that some of these residents are facing. The first one being the access to healthcare providers. So it's pretty limited, especially in Avenal and Corcoran. These services may not be available to them, like sometimes they have to wait a few months to get seen, or they need that specialty care, and then they have to travel outside of their communities, again, outside of their counties. Transportation is another huge barrier that we typically see. These residents are not able to travel to the appointment. So let's say, yes, they've connected with a provider, but how do they get there? So that's a delay that prevents them from getting the care altogether. And it goes aligned with why sometimes residents rely on emergency services or they delay the care. Sometimes they do have these barriers where until it becomes an emergency, or the condition becomes a lot more serious, then that's when they're seeking the care, where we typically like to promote more preventative care and then more management care to avoid those emergency services or serious services. And then overall, just resulting that many of these individuals are living with chronic health conditions that often go unmanaged. And sometimes they don't they're not aware of the support they have or the resources that they have to manage that type of care. So that can be another limitation, another barrier that we're seeing. So pretty much to give you guys, excuse me, an idea of what we're doing and how this program is working, we do meet with residents where they are. We are servicing them in person in Avenal and Corcoran right now out of our public health clinics. And so essentially what we're doing, we're helping these individuals navigate the healthcare system, connecting them to resources, supporting them through referrals and following up. One of our biggest goals here is not to just give them a name and phone number and say, okay, off you go, right? And so definitely following through with them the whole way is one of our biggest goals that we have. Part of our care coordination efforts, we do utilize the Smart Referral Network to connect the clients to the services, and then we track the outcomes. And so definitely having those strong partnerships has really been a benefit for us and will be a benefit in the future as we gather more partnerships to be able to support these specific participants. At the same time, we're continuing to build a coordinated network of partners. And so this is where the partnerships come, right? And so this is using the data to improve how care is delivered across the system. What we're doing, what our partners are doing, and how can we deliver that type of care to these individuals. Essentially, a key part of this program is our telehealth access. You will see two pictures here displayed on the presentation. We have dedicated rooms at our sites that are fully equipped to provide a private and supportive space for virtual appointments. Our community health assistants are available on site to assist the clients, which essentially reduces barriers for individuals who may not have access to the technology or that additional support. These two pictures here are from our Avenal clinic. Our Avenal clinic is currently equipped with our telehealth monitor, as well as a webcam, speaker, chair, and tables. And so we do have that access available for our Avenal residents. And then we are building something very similar to in our Corcoran location as well. Essentially, this creates a strong opportunity for partnership. We are seeking partners who can utilize our space and help out our residents in Avenal and Corcoran, as sometimes we do see that barrier for transportation is an issue. I'll go ahead and let you guys know what our vision is. So our expected impact, right? Like, what are we trying to achieve here? What are our hopes with this grant? So the goal for this program is essentially to create a long-term sustainable impact in how residents access and receive care. So essentially, we're working to increase access to both healthcare and supportive services, while also helping the residents in Avenal and Corcoran get connected to a consistent source of care. We call it a medical home. And so essentially that's a primary care provider, right? Are they established with a provider? Are they routinely getting checked? Again, avoiding those emergency visits. Telehealth does play a key role in this because expanding access to services will be very important if they're not available locally. And so we are seeing that individuals are interested in telehealth, at least from a couple of the surveys we've established or we've received. We do see that individuals have never done telehealth, but they're open to it. And so now it's like, okay, how do we implement telehealth in this community, right? At the same time, we're focused on improving how chronic conditions are managed by helping residents stay connected to care and follow through with those services. And so finding providers that can virtually offer those services would be very helpful to then ensure that individuals are educated and they're managing those chronic conditions correctly. Another major component for this work is strengthening and coordination across healthcare providers and community-based organizations. And so really all of us being kind of in a in a way of communicating, right? And the Smart Referral Network has been very beneficial to learn who's doing what and how can we support other organizations or other providers. How do we get the clients in the door? We're also tracking our progress through the referrals, through service connections, telehealth usage, overall outcomes, so we can continue improving how services are delivered. So again, like I mentioned earlier, the program is fairly new. We're about 6 months in providing that direct service. These first 6 months have been really just learning the community, learning what's out there, what is needed, and really kind of being boots on the ground, right? So these early results reflect that the work that we've been doing out in the community alongside with partners. You will see the photo here. This is from one of our outreach events that we had in February. We got together in Corcoran and hosted a health resource event at the RAC, which is the Recreation Association of Corcoran. And we brought together 13 partners, 13 organizations to provide services and valuable resource information directly to residents. So the individuals you do see here in the picture are all the partners who were servicing the community that day. Events like this allow us to connect individuals to care, provide screenings, begin building relationships both with the community and then with our partners as well. Many of these initial connections don't stop just at the event. What we're doing is we collect surveys during these events. We collect data and contact information to follow up with individuals. We continue supporting the residents through follow-up care. Some of these individuals then meet us at the clinics for an individual private consultation, where essentially we're doing an intake, a needs assessment on them. And so we are reviewing what are their needs, what are their barriers, who can we refer them out to, what type of support they need, right? So really offering that care coordination to ensure that they're being connected to the services they need. The Smart Referral Network, again, I can't speak more on it, but it's really helping us connect those individuals to our partners. You know, supporting the clients beyond the initial outreach is what is very important to us. Strengthening that follow-up, having that coordination and communication with our partners, which is why it's very essential to do that closed loop, right? This also highlights the importance of the strong partnerships. The more connected our network is, the more effectively we can support the residents and improve outcomes. So just even learning off of one another what our resources are can be very helpful. We have done introductory calls where we just sit with our partners and learn more about their resources. So when we are meeting with individuals in person, we can speak on your services and the resources that they have available. So that's definitely growing, and it's continuing to strengthen as we develop. So this slide here is, it gives you a little visual of some of the partners we are working with and have worked with. This program is definitely built on partnerships, and we're continuing to grow our network of organizations that are supporting residents in Avenal and Corcoran. Essentially, we really want to learn about what's available to Avenal and Corcoran, so we can speak on it. There are several ways to get involved. One of the key ways is, again, through the Smart Referral Network, being active on it, really really looking into strengthening that partner participation is helpful to ensure that the referrals are being received, they're being responded to, they're being completed. We also offer opportunities to provide services directly. So whether that's through the outreach events, you participate with us, set up your booth, your table, or by utilizing our telehealth spaces. So we'll provide the service. We'll provide the space, we'll host the event, we'll provide the equipment at the location and on-site support, and then partners can deliver those services virtually if you'd like to partner in that way and utilize our telehealth space. Ultimately, we've built the structure to connect the residents to the care. Now we're looking to strengthen it through partnership and collaboration. So that's definitely one way, that I like to preface it is we're providing, we will provide the access, right? And you, the partner, can provide the services, and then together we're expanding that type of care. So here I'll go ahead and display my contact information. The QR code does take you to our website. Our website also has a questionnaire, not questionnaire, but essentially you can fill it out if you would like to reach out to us, or if you have an individual that may need assistance, they can schedule an appointment with us by leaving their contact information, and we'll follow up. I really want to just thank everyone for hearing me out today. Really appreciate the opportunity to share about our program. I can pause and answer any questions that you guys have right now. If there's nothing that comes to mind, again, contact information is on the screen. You guys can reach out to me via phone, email, through our website, and then we can continue the conversation about exploring ways that we can work together. Any questions?
No, and just to kind of, oh, I see a hand up. Fedison, if you want to go ahead and ask the question.
Leslie, thanks for that presentation.
Of course.
Are there any other service gaps that you're seeing in these areas that maybe there might be other organizations that you can partner with?
So at the moment, the biggest one again is the primary care provider, right? There's been a lot of feedback that it's long waits. And so individuals are just not going in, they're not making those appointments, or they're long waits. And so that's why partnering with our providers who offer the free medical exams, the free health screenings has been beneficial. We're fairly new in Corcoran. We just launched in March, and so we still haven't learned that community as much as in Avenal, where in Avenal, that's the feedback we're getting, right? About we've noticed food insecurity. We've connected them, individuals, to a lot of medically tailored programs, and so that's been successful. Utility assistance, housing assistance, and so we've been able to submit referrals that way as well. But that's at the moment what we're seeing.
So many of their PCPs are going to be located in Lemoore or Hanford?
Yeah, so they do have FQHCs in Avenal and Corcoran. Sometimes it's just hard getting in right away, or it's long waits, or they're just not continuing that care, where it's maybe like a one-off kind of situation, where we're really promoting like at least yearly checkups, or if they have a certain chronic condition, like how are you managing that? Do you need more education? If they're not there yet, how can you prevent that?
Thank you.
Do we have any additional questions we would like to ask Leslie regarding the community wellness program? We have one more. Yvette de la Cruz, if you would like to unmute yourself and ask your question, you're more than welcome to.
Hi, I'm a clinic operations manager for ARIA Community Health Center. I actually oversee the Avenal site, and I'd love to connect with you to see if there's something we can do to overcome those barriers. I think our site would, be open to getting those patients in. So definitely, if there's anything that we can do on our end, we'd like to collaborate.
Perfect, Yvette. Yes, if you don't mind sharing your email, or you can email me, and then we can definitely connect. That would be great.
Sounds good.
Thank you.
Just a question and request. So I'm a supervisor for the parole office in Hanford. We supervise the Kings and Tulare County areas. Our department actually services our population with a monthly meeting. Typically, it's the first Thursday of every month, but we always invite providers that are going to serve our population. I think this is a program that would directly service our clients well, because a lot of our folks don't necessarily put emphasis on their health. And when I'm asking those questions, I see the big need there. And I know you're servicing these two areas, and we have, somewhat of a population, not too much. Primarily, it's in Tulare County or bigger numbers, but we still have folks in Kings County that would benefit from this. Our program specialist coordinator is Jasmine, and I've CC'd her your information, but I would love either for you to be present there or maybe a future presentation. So we'd definitely love to collaborate with you in the
Yeah,
future.
no, absolutely. That's great. I took your name down as well as Jasmine's. But yes, if you guys don't mind either sharing your email or same thing, send me an email and I'd be more than happy to connect.
Thank you very much.
Thank you. Any other questions? Again, if something comes to mind in the future, feel free to reach out to me. I'll be your point of contact. We are in the process of onboarding 2 community health assistants. And so once we have that information, I'm more than happy to share them as well.
Thank you very much, Leslie. Thank you again for the presentation on the community wellness program. It was an amazing presentation. I think we all learned something today, and then we also all made great connections as well. So I'm happy to see that we're making connections with our partners providing that spotlight of service. I do want to go ahead and say if we do have additional questions for Ms. Leslie, if we can go ahead and include those in the chat. We are going to go ahead and move on over to our community partner panel. We do have a panel that will be coming forward with you guys that will be able to share a couple of their insights of how the Smart Referral Network is working for them, how they're managing that referral workflow. Fedison, if you want to add a little bit more to that before we bring the panelists forward.
Came up with this idea last month. So I think these meetings are starting to move away from what is the Smart Referral Network towards how can we apply the Smart Referral Network to our daily workflows. And that's a question that we get a lot during demos and trainings. A lot of other organizations that aren't on the Smart Referral Network have these kinds of questions. So we assembled a panel of, I think, looks like 5 individuals. Or Maria, you're muted.
We have 3 individuals. Sorry.
3.
Yes.
Yeah, we have 3 individuals who've been using the SRN and are willing to be part of this panel and answer questions that anyone might have. If you're curious about joining the network, how does it work within an organization, which employees should be using the SRN, at what point in their workflow should they be using it? So yeah, Maria, do you have, can you introduce everyone that's on the call, that's on the panel?
Yeah, of course. So we do have our community wellness, which is Leslie. Leslie will be part of our panel today. We also have Sarah Ramos. She is with our UCP organization. Sarah, can you just go ahead and raise your hand? That way we have individuals know. There we go. Miss Sarah just turned on her camera. And then we also have our I'm looking for our next individual. Let me go ahead and make sure she's on the call. Oh, there we go. Miss Lisette, there you go. Miss Lisette is from our Project Food Box. These are 3 different programs with different services, and we wanted to go ahead and bring them forward for you guys to be able to ask any questions that you guys may have regarding our Smart Referral Network.
So I can kick it off. We have some questions prepared, but if anybody wants to jump in with questions, feel free to raise your hand, and then we will pause and address the question. But for now, let me start with the panel and anyone who is brave enough to go first. To start, can you describe how the SRN fits into your overall workflow and who on your team uses it?
I can go first, Sarah and Leslie, if you're okay. Hi, you guys. I'm Lisette, Community Outreach Specialist with Project Food Box. And to start, I'm wondering why we don't have more people participating in SRN. So hopefully with the questions and the answers provided, we can have more people jump on board. I'd like to say that the way that we fit, or I fit, right, SRN into my daily workflow is just checking either in the morning or towards the end of the day. And sometimes just setting a calendar reminder, because essentially what it is members waiting for services. So that's kind of where we have to keep that in mind. And we don't want members to just wait for the services when they're in dire need. So that's kind of how I put it in my head to make sure, hey, SRN, I got to get on SRN, check those referrals, and just time, slot the time to get those referrals done. That feels good at the end of the day, making those connections. It's kind of easy. I feel like it's just a very easy thing to just squeeze in, and I think those that are doing intakes would be perfect to fit that into their workflow.
And then, Lisette, if you don't mind the follow-up question, are you the individual who goes in to respond to the referrals for your agency, or do we have other individuals from your team that are currently utilizing it?
So currently at this time, it's myself, and I know that we have Deanna Oseguera that's out there in Tulare County, but she's fairly busy. So I find it's mainly me for the most part. Soon we'll be dipping into the Monterey SRN as well.
Well, thank you, Lisette, for that response. Fedison, if you want to go ahead and continue.
Do any of our other panelists want to chime in about how the SRM fits in your current workflow?
Yeah, I can go ahead and mention how we utilize it. So primarily it's used by our community health assistants. Currently myself, as we're actively hiring. But yes, the community health assistants have this responsibility to essentially manage the Smart Referral Network. It's their cases, and so following up on their cases, checking what status they're at. If they need to follow up with them, or if they need to follow up with the referring agency. So something I failed to mention during my presentation is we submit more referrals than what we receive. Again, because our initial service is meeting with the individuals and learning their needs, and then referring them out to the services they're needing. And so we do submit a lot more than what we receive. And so for us, it would be following up on those notes on the referring agency, letting us know what the status is on this referral. And then from there, let's say if there's a particular issue or maybe decline, not eligible, then us coordinating those additional services and that additional an additional partner that may be able to, then offer that assistance to them. So for us, again, it would be the community health assistants, myself overseeing that type of work. And then for us, it would be, we go out and do outreach, we do an intake appointment, and during that intake appointment, we then learn what do they need to be referred out to, and then we submit those referrals via the Smart Referral Network.
I want to give Sarah a chance to answer this question too.
Okay, so for us, we have multiple different departments, which I understand everybody does. So our referrals come in are screened by our office assistants and then referred to the appropriate department. The people that are sending out the most referrals are people in our Family Resource Center or our outreach. We did have a lot of trial and error with our workflow. So this is our current workflow. We were not I will be really honest, we were not responding to the referrals that we were getting at a fast pace. And realizing that we needed to change the workflow, so that we have adapted this to make it much easier. We have received more referrals than we have sent out, but I anticipate that changing.
All right. Thank you for those insights and the way you're able to adapt to the different volume of referrals. Maria, do you have anything to add?
No, if we want to go
Just
ahead and continue, yeah, if we want to go ahead and continue to the provide an
maybe just
open floor.
a follow-up question to the group. Does anybody have an idea of how much time you or your staff are spending in the SRN per day or per week?
I would say my office assistants are checking the SRN every morning. Our FRC is as needs come up, and the same with our outreach coordinator. So I can definitively say at least 5 to 10 minutes a day. But again, that depends on when parents contact us for referral.
And I can because I am a part of outreach team for Project Food Box, I can tell you that yeah, probably like 5 minutes to check SRN daily. But then when I actually have contact with a member, it can take 15 minutes. And hopefully soon I can start referring as well, because I did forget to mention that we are receiving referrals but haven't sent referrals out just yet. But I would say 15 minutes per member.
And then Leslie, would you like to go ahead and give us a response for that follow-up question as well?
Yeah, so for us would be similar to what like Lisette was saying, doing a daily check, right? If the status has changed. But when that initial contact is with the client, we do kind of do like a case management system, like note taking. And so on our end, just making sure we're inputting that in the Smart Referral Network or vice versa, checking the Smart Referral Network so then we can update our case notes as well in our own tracking. So I would say it would be more of a daily thing, like quick checks. But as far as like the length of time, it would be like, we call it an encounter. And so at this point, we're encountering with the individual, we're following up, whether it's in person or over the phone, and it's regarding their referral while we have the Smart Referral Network up.
All right, thank you. So those were the first initial questions. I want to pause here and give the rest of the group a chance to ask the panel some questions.
If you guys would like to unmute yourself. Oh, we do have one individual. Alexander, you're more than welcome to go ahead and unmute.
All right, thank you. Good morning, everyone. To the ones that are using the service, what I'm hearing is like 5 minutes seems to be about the average. It's really quick to check, and it's the case managers, the ones that are going into it and following their cases. Has as far for for myself as a community navigator, I manage a caseload essentially a little bit over 100 people. How is there any like in using it? Is there any way to highlight or star specific individuals within the portal itself to, like, let's say I need to keep track of these referrals for these specific clients. Is there any way to separate the list, or is it just one giant list of clients in there? I haven't used the system yet. We're currently going over our MOU with our legal department with my agency, so we're waiting on that. But once that gets pulled through, then I'll be able to use the system. But that's my question: is are you able to separate the list of clients within the portal itself, like just to follow maybe some that are that have higher needs and more needs and need more care or more attention than the others? Is there a way to separate that within the SRN?
Maria, are you able to show him? Because I was about to ask, like, have you been on the SRN? Because it does have the outgoing referrals, the incoming referrals, where it's not just one, giant list. And that's what you want, is a giant list for you to be able to go through the members. But it is broken up. So I don't know if Maria was able to show you what it looks like.
Yeah, so just so that I understand, Alexander, you want to make sure that you're able to access that client list, right?
Correct. Access the client list, but also kind of separate them. Like maybe
Priority
I have
clients.
like priority clients, like a high risk, and then I have a moderate risk, and then because sometimes for the most part, my clients I have high risk, I have moderate, I have some that are lower risk, like they probably have the assistance that they need, or they have employment and other things that they're more stable versus the ones that are higher priority or higher need that have absolutely nothing, and
And
I need to keep track of those.
that's a great insight, and something that we currently don't have a way to mark off in the software, but you can in your inbox search by name. So if you have a list
Okay.
that you have on the side, you can just type in their name in the inbox. It'll just pull up those names. But that's a great feature that we could look into.
Okay. Yeah.
Does the rest of the panel have ways to address this kind of workflow?
And then if you guys don't mind me kind of just providing a little bit of feedback with that, Fedison, we also have some reports available that you're able to complete for clients within the SRN. These reports are social determinants of health reports that will give you an outstanding status of where your client is with those direct needs as well, Alexander. So you're able to go in and initiate one of these reports, and it kind of focuses on those categories that you're referring to. So education, job retention, income, budgeting and savings. All of these are informations that we're able to kind of just collect during casual conversations. So we do have those reports available for you. You're able to complete those on a 90-day time frame, so you're able to track some of those outcomes for your clients as well.
Okay. Yeah, that I appreciate that, because that's one thing for me is to keep track of my homeless transient caseload, or the clients that are in that high need, and the unemployed, and also both, and be able to generate some kind of report so I can keep track of where everybody is and their progress, and to be able to move them from like a high risk category to a moderate risk, and then eventually a low risk, because that's the purpose that I serve in my agency here in our program, is to get them from that high risk level to get them to low and get them stabilized. Basically, stabilization services is what that's the assistance that I provide here.
No, but we
Is
do
it?
have those reports available, but go ahead, Fedison, I'm sorry.
I was just gonna pitch it to the panelists if they have any more insights on this question.
So maybe not helpful insight, Alexander, but definitely honest insight. So we have seen about roughly 30 to 40 cases thus far in the 6 months that we've been active. And it's been easier to manage because it's a low, not low number, but it's not like what you're seeing, right? Hundreds cases. And so on our end, because right now we're still learning also the Smart Referral Network reporting system, we are tracking our own case notes and in a way know to type in the name of a certain individual in the SRN because of our case notes that we have on the side. In addition to that, Maria and Fedison have been very helpful teaching me how to use the reporting system in the SRN. And so I've learned that we're able to also sort out information in those reports. And so maybe, if there's not a particular function that shows high, moderate, low, maybe like even pulling a report that way and utilizing the data, because you are able to then notice who's still waiting, who's been closed, who's been open. So maybe even filtering out like who are the ones who have been waiting. It does say when the referral was submitted and how long it's been open for. So that can be helpful for you also. But I think once we begin growing a little more and have more cases, I think to your point, it would be helpful to have some sort of function of, high, moderate, low, because then that would be an easy way to let's check out all the high, let's check out all the moderate. But at least right now, that's what I've noticed, that it can be utilized that way.
Thank you, Leslie. Appreciate that.
Any more questions about basic workflow setup? All right. I'm assuming everyone knows how to set up the workflow now. So next question. What challenges came up when adopting the SRN in your organization? Anyone want to go first?
I think I kind of answered that in my first one. Us was establishing what our workflow was going to be. That was a challenge for us to figure out how to incorporate it into what we currently do. That was a challenge for us.
And can you elaborate on that a little bit more?
Trying to figure out the right person, the right flow, who needed to be in charge of it. Our agency is also in flux and changing departments and changing titles, and so it was really trying to make sure that the correct people had access to it, that were going to be doing the most connections with it. So tying it to one person did not work, because if that one person was out, it wasn't going to work, because then these are piling up. If we added it into our intake with our office assistants checking it daily, then we were able to have a team accessing and responding to those referrals and making sure that they're connecting to somebody who's actually in the office. Having the people that are actually doing the direct service to the families having access to go in and send out referrals was also something that we changed. Again, it was just kind of trial and error. It makes so much more sense now why we didn't do this in the first place. But again, I'm going to be really honest on things that we are not doing well, because if I can stumble through something and save somebody else time, I'm definitely going to admit that.
Thank you for sharing that. That was really important insight. Any one of the other panelists want to answer?
Yeah, I can go ahead and go. So I think like anything new, right, there's going to be a learning curve. For us, it was just, the staff learning to navigate the system, knowing the functions of it. For us, probably as a individual program, we were trying to figure out like what referrals are we submitting, what is considered a resource and maybe not necessarily a referral. And so in the very beginning, some staff may have been submitting referrals that were technically not referrals, and it was more of just like a resource available. And so that could have, played with our data a little bit as well. And so it was just really coming up with our internal process of how to utilize it, right? Of course, I can't say this enough, but promoting the partnership is very, very important, because yes, we may be submitting the referrals, but if the partners are not utilizing the Smart Referral Network or they're not onboarded, it definitely then it's a little bit extra work, where then we go out of our way to then follow up and say, hey, we submitted a referral. You're currently not a partner of the SRN. What's your current referral process? Again, to not limit the individual to get the help they need, right? And so if a partner's not on the Smart Referral Network and they ignore our email, we don't follow up, then that individual doesn't receive the service they need, and the referral still submitted in there, right? And so I think it was just really learning that internal process of what works for our team and what does our workflow look like to follow up and ensure that these individuals are still getting that help that is needed. But again, if you have not joined the Smart Referral Network, please do so. The larger numbers we have on there, the more beneficial and helpful for everyone.
Thank you, Leslie. Can you clarify what you meant by the difference between a resource and a referral?
Yes. So we had individuals submitting a referral in the Smart Referral Network, like let's say PG&E, right? I think they were looking for some sort of assistance there. And so although we know that there might be some financial assistance that PG&E can offer, PG&E not necessarily has a referral process or a referral system. So it may be a resource available to them as far as assistance, but not necessarily maybe a localized organization that will be servicing via the Smart Referral Network, or maybe a referral where like Project Food Box, we're submitting a referral, they're getting their food delivered. It's a closed loop, right? Where PG&E, sometimes like those financial assistance programs are based off of eligibility, and it's maybe more of a resource that we can provide them with the information versus like an actual referral, because PG&E doesn't have a referral process. It's like their own individual case by case. They have to reach out and then check. Does that make sense?
Yeah, and I
Perfect
think
sense.
maybe food distributions could fall in that category too. You can
Yes.
provide the
Correct.
information to a food distribution, but the client doesn't need to, you don't need to know that they've been closed, or
Right.
because there's hundreds of people showing
Of
up to
food
those food distributions.
distributions, yes, correct. And so that was an internal issue we were having where we were just submitting everything. And it's like, oh, wait, but like technically that was just a resource, right? Like it wasn't like for a referral for a service. And so then that triggered, our numbers to be a little, they fluctuated where we're like, okay, maybe that's not as accurate because this wouldn't have counted. So that was like a challenge we were having in the beginning.
So correct me if I'm wrong, for as far as a service or for a referral, like the way I've been directed for referrals to do my referrals is if the service can be verified on the receiving end of that referral, that's a true referral. Like if somebody can verify that person was seen by a counselor, seen by a provider, seen by whatever it is that they were referred for, if it can be verified, then it's a true referral. Otherwise, it's just a resource provided. That's how I understand it.
Correct. And I also like to say that it's more of a warm handoff because you know who's receiving it versus just providing your client info about the service and them taking upon themselves to call or fill out an application online. But we are hoping to maybe address that distinction between information that you provide to a client versus an actual warm handoff. So hopefully this conversation sparks something in hopefully creating a feature like that.
Could that be something for the SRN information when providing SRN, not just guidance, but technical help, or even just part of the SRN, like, hey, when as a how-to, for example, for the agencies participating in SRN, kind of being like, hey, when you submit a referral, in this may be like some criteria that the agency follows. Is it a resource you're providing, or is it a true referral that you're needing confirmation from? That way, all of us agencies are following the similar criteria when we're submitting referrals. That way, we're not mixing it up. Kind of like what Leslie was saying is we thought it was referral, we thought it wasn't, and that way everybody involved in SRN is following the same criteria and guidelines.
Right, and that's a good point, and that's something that we've thought of quite a bit. Right now, the software doesn't allow you to make that distinction, but you do want to document that you sent someone to a food distribution, but you don't necessarily need to know if people in that organization actually check them off, because that'd be really impossible to do. So, yeah, Maria, do you have any thoughts from your network on how they solve this resource versus referral problem?
No, yeah, of course. So, within the Smart Referral Network, the information that's listed within the referral process, it's giving you the name of the agency, the description of the program, the eligibility, the application process, and so forth. This is all information that we can read through and provide directly to clients. And again, we are able to distinguish those programs by reading that description information within that platform. But we don't have something we can say like, oh, we have a procedure in place that we've distinguished separating the programs, but we've been able to let our community partners know, read through that information before providing a referral, and ensure that this is a program that will be fully closed as a loop for your agency, ensuring that that service will be provided directly to that client. that's what we've been able to communicate forward to our community partners. Again, these are programs that are listed within our 211 program. So we've kind of, we want to make sure these are services that you guys are still able to promote to your clients. We just kind of need to distinguish those programs. But no, other than that, it's just pretty much reading that information and ensuring that you guys are aware of which services will provide that close loop.
All right. So we don't have a lot of time left. I do want to pose this last question. What advice or best practices would you offer agencies to get the most out of the SRN? And I will give this to Lizette.
So, thank you. The way to make SRN successful, and why wouldn't we all want that, right? Is sign up, be a part of it, and get it into your daily workflow. Because the more members, the more partners that we have being a part of SRN, just we're able to collaborate with each other and get the services, the referrals out there for these members. It just makes sense, just like being on this call now. And after Leslie doing her slide and providing us that information, she's already linked with 2 partners. And ultimately, in the end, it's going to benefit the population that we all serve. So that's everyone. I am recommending jump on, and once you get on the platform, you're going to be able to see how great it is, and you'll be able to answer the questions that you have in mind right now. And then you know what, the feedback, Alexandra, that you just gave with highlighting what's most urgent, what's I guess less urgent, is great, because Fedicin and Maria can some way somehow figure out how to make it happen, as they've been doing so. So it's amazing. That's all I got to say. There's a lot I can say, and I talk too much, so I just got to zip my lip for a second. But jump on, you guys.
Thank you for
Thank you
that.
so
Thank
much. I
you.
wish I could end the meeting on that note, but I wanna give everyone else a chance to ask some final questions before we start winding down here.
If I can just add, so on my end, I would just say, being consistent with your team, really establishing a workflow, identifying those roles, responsibilities, who's managing it, how often, that's really going to help. And then ensuring that referrals are complete, they're clear, there's notes, for those who are already a part of it, and for those who are thinking, again, that would be probably like the best practices. Like, when you're jumping on or being onboarded to SRN, those are items you can start thinking of in the beginning to try to establish that foundation from the get-go. And then obviously the biggest thing to follow up with what Lizette said is just really encouraging partners to get on the SRN. If you see that there's partners or agencies that are missing on this call that can benefit from it, just advocating the SRN, word of mouth, inviting them to our next call, that would be, again, very beneficial. The more we can speak on it, the more we can encourage others. I just think that the stronger partner participation that we have is going to really depend on, how successful this SRN, this platform is. Again, just the more engagement we have on the platform, the more active it's going to be, and it'll be very helpful for everyone.
Thank you, Miss Leslie. And then I see we also have a question in the chat, just to kind of touch bases on that as well. I do see how
Tony asked a question. How many partners are currently in the SRN? And maybe you can answer that for Kings.
So for our Kings County Smart Referral Network, Kings County currently has 16 agencies that's able to log into the Smart Referral Network and respond to referrals. And we currently have 59 users who are also able to log in and actively respond to those referrals that agencies are providing.
And currently, Tulare has no active partners yet. Everyone is still reviewing their MOUs, but I will say Kings was about a year and a half ahead of us. So, yeah. Any other questions before we? So, copy of the meeting notes provided and a video. Yes, we are recording this. I think we'll work with the team to send out copies of notes and videos as once the meeting is concluded. Any other questions? I think that's it. All right. Thank you, everyone, for participating and providing your time to us this morning. Thank you all. Thank you to all the panelists. Leslie, you did double duty today. Appreciate that. And feel free to send us any questions that you may have. Our contact information is in the agenda. Maria, do you have anything you want to add?
And then just to make sure that you guys are all aware, if you wanted to review the MOU for either Tulare County or Kings County, the MOUs are attached as well to the agenda. That way you guys are able to review that information for your agencies if you guys are interested in coming on board to the SRN.
Sounds great. Thank you so much. Bye-bye.
Thank you all. Have a great rest of your Thursday.
All right,
Thank you.
Thank you.
Bye.